Miss Angie and her team are here with us, and they can share insights about how this program has been going. Council members, if you recall, this was part of the you recall it coming to life, and really was a collaborative effort to bring us to this point. So this is a great opportunity to receive an update.
Good afternoon. Thanks so much for having us here today. The topic that we just covered is a day in the life of Family Crises Fund. So if I can sidebar just a little bit, it's me. We're getting these calls. I mean, we're the 1-800 call. Hate to say it, Angie. So I've heard. I would like to recommend if we could use some of the DoorDash that we have. If we can funnel and help folks with groceries and/or prepared meals, let's do it. We have thousands of dollars in that fund. So, and the switch can be turned on.
Great. How soon can we turn it on?
That's how we roll at Family Crisis. We do have a report, and I thought it would be beneficial to have one of our partners actually speak. And she has a lot of insight on things we've been talking about today. I have asked a dear friend that I can call morning, noon, night, and weekends because, that's what we have to do when folks are in need. And this is Makita Harper Bird, good friend, project team leader at the YWCA, and I'm going to let her just speak for a few minutes, and then I'll go into the report if that's okay.
I'm a little hoarse. I've been on call, but thank you all for having me here today. And Angela, thank you for inviting me. I am Makita Bird with the YWCA of Richmond, Virginia, domestic violence and sexual assault team lead for our emergency shelter. It was great sitting here today, but I just wanted to give a little information about how important Family Crisis Funds is to our agency and our survivors. The monies that are filtered down with the collaboration and the team efforts of Humankind and the YWCA to assist our clients who are in imminent danger is imperative and so needed. As I was listening and I heard Congressmember Woman Lynch say imminent danger is so important when we have clients that we are dealing with coming out of domestic violence situations, homelessness, and I kept hearing you say families, right? But I also heard single shelters for men and women. We're looking at families, mothers, fathers, people who are dealing with imminent danger, crisis situations where we have to go in and put fires out who have absolutely nothing. And then to have to possibly wait 10 days to receive EBT and or be turned away from the HCL 804-972-0813 and the beds are full. We're getting that overflow. And it is disheartening to know that we are still dealing with the crisis of homelessness and families and persons not being able to eat, things that we take for granted. As I sat in the back and I listened to the young ladies that came up and their passion, I didn't see it as being angry. It was their passion to have the equality, the rights, the human rights to shelter or a home, decent, safe, and affordable housing. They don't have that. So I am so honored and so privileged to be able to work with Humankind when we have clients or survivors that come in with no shoes on their feet in the middle of the night. I've been on call, 3 a.m. this morning, I got a call. And I'm here today standing for those that can't voice. Not a birth certificate, not a social security card. Yes, the budget needs to be up. Absolutely. We need those funds because many of the shelter beds are full. But getting back on track, Humankind stands in the gap for our agency where we have several testimonies where we may not be able to assist, and I can reach out to Angela. For instance, the funds have been filtered down to one family, HIV client, homeless, domestic violence situation in a hotel on RHA's wait list, 5 years. She was able to come into our shelter, and we do not have brick and mortar. We are in the process of building, but right now the YWCA does not have brick and mortar. So in the process of building, but we are hoteling, which is a new way, unconventional way of housing our community. She came into our hotel, stayed 2 months, and she was able to, with our wraparound services, get a job. But she also needed funds to get first security deposit, first month's rent. Humankind was, they qualified, she ended up qualifying, and we were able to house her. And so now she's permanently housed, working 2 jobs, and dealing with her medical condition. She is self-sufficient now. Thank you for those funds. Those funds are not just for housing. We had another client to come in. She is dealing with domestic violence. She works part-time, but again, she didn't qualify for child care at social services. So with that being said, she was paying out of pocket rent, along with child care, along with gas, and other basic need items or daily expenses. So her child care ended up getting behind, which put her in a predicament where if she couldn't provide child care for her 3-year-old, then she wouldn't be able to work. Humankind, here we go again, Richmond Crisis Fund stepped in and was able to pay her balance and allow her 2 extra months. Thank you. Another situation that we use family crisis for is where the domestic violence client that came in worked full time. She's going to school for higher education. Her car, she needed repairs, $1,700 for a car and insurance to get back and forth to school, transportation for work. Here we go again, humankind. Those funds are so valuable to my clients who I assist and my agency assists. We are so grateful for this partnership. So thank you again. Thank you for the opportunity to just let me speak on behalf of the YWCA and the partnership that we've created with them. We're here. We are direct service workers. I'm enjoying the political, but I tell you, it's nothing like a direct worker who is hands-on with our clients. We hear the stories, we see the tears, we see the trauma, and we know that these monies are needed. There should never be a time when we say we have enough. There is not enough. So thank you for the opportunity to speak. No.
I really, truly appreciate that. And couldn't feel you more as somebody who also does a lot of direct practice and hears those families and sees exactly what people are going through and what it takes to get them from point A to point B. There's a reason why I get a little passionate up here from time to time. So Angie, thank you for being here with us today, and go ahead and run through the numbers with us. And
Just run through the numbers. Big picture, the Family Crises Fund, we have now completed 2 years, if you will. We started with a soft launch in November 2022 and officially 2023 and now through 2024 and getting ready for the next year. Just a quick overview, we provide funding for those who are in crises that are City of Richmond residents that are age 18 or over. And that's with or without children. And our partners, as an example, certainly is Makita and the Y, and I see William is also here as a partner as well with this initiative. Thank you very much. We also have ACTS, Communities in School, Healthy Families, again, Help One RVA, Home, and also now Southside Housing that they are assisting with the eviction diversion program, Neighborhood Resource Center, without a doubt, Underline Office of Community Wealth Building, Sacred Heart, Senior Connections, Urban Baby Beginnings, and Virginia Poverty Law are the more formal partners, but needless to say that as the need arises, if there's another organization that needs support, our door is always open and we work with them to meet the needs of their client or a particular program that has to be addressed. Let's see, big picture. We've made about 1,810 payments to assist 2,370 households with their financial obligations at the start of this from January 2023 all the way through to October. There is a chart listed there and simply stated, and certainly the conversations today and what we see every day, and that is a tremendous need for housing support. The numbers here are going to be kind of hard to see, but wanted to have for benefit of council a breakdown of the dollars that have been utilized. Simply stated, because it's going to be kind of hard from this point to see it all, but we have funds of close to 2.6 million that we've used since the inception of the program for the funding of the needs of our community. I've got a little more detail in terms of how it broke down, the timelines, when funds were dispersed to us. There were a couple of times where we utilized credit card because the household was in an emergency and it was the best way to serve that family's need. And then we have some other housekeeping breakdowns in terms of how those funds have been used. Program activity. I thought I'd give a bit of a comparison in terms of where we are today and where we have been. Starting November of last year through October, we served 898 clients with a total of 1.6 million in payments, consisting of 1,045 payments and 300 vendors, most of those vendors being housing related. Dominion Energy has received 129 of those payments, 12%. Needless to say, the vast majority consisted of housing. The average amount per client was $1,828.84. For the most part, 88% of the clients had only one bill paid, which was for an average, which was for housing, which was about 78% of the time. No surprise, just kind of comparing to last year, the numbers are about the same. Last year, compared to 898 clients that we served, this year we served 700. Last year, we allocated 1.3 million in resources compared to 1.6 this year. Dominion Energy was more so when we first started, it was 152 payments compared to 129. So the numbers for the most part are parallel in many ways. But I would say the beauty to seeing this is it helps us better target and focus and understand the need. Client demographics. The majority of the clients that we serve for the city of Richmond are African American, female, and between the age of 25 and 45. That, quite frankly, when it comes to eviction on a national basis, as reported by the Eviction Lab and other sources, is pretty much on par. And hopefully will provide the data to help us be more targeted in our approach in meeting the needs of our community. And I would also say in terms of income, in terms of the AMI, most of the folks that we serve are at the 50% benchmark. One of the meetings that we had, there was a reference to better understanding the youth involved. So we've just begun, if you will, tracking the youth that are impacted by this. And again, with the conversation we've had today, understanding how important it is to take care of families. For the most part, again, very similar to last year. You do see a dip, though. I do want to highlight that for September of this year, we did not have funds at that time. So that's why that bar is set where it is. They say a picture's worth 1,000 words. I'm going to move this up. All right. Work diligently on this, and now I can't see it. So, but there is a heat map that shows client location. Again, south side, east side, as in last year's presentation, were key areas that needed service. Makita was kind enough to truly speak from the heart of and her passion in how she serves our community. I did also include some additional testimonies, if you will, to better understand those of our communities that need service. And so I've got listed there different scenarios to share. Not only is it a matter of housing, unfortunately, one too many of our clients are just dealing with the academics of trauma. And that was one of the cases with Tiara. So I wanted to share there's more to this than housing. It's transportation, it's mental health, so many factors that we see and try to support with the Family Crises Fund. And that's it for me.
Wow. I mean, I see this work every day, so it's wild to take a 10,000 feet view of the data, and really kind of dissect where the needs are being met. And I, this is probably one of the most incredible tools that a social worker, case manager, anybody that's working with our families in need could ever have. Because quite simply, you can do the best case management in the world. But when you're talking about a family that is needing to come up with thousands of dollars at a time to get into a new apartment, to fix a car, to pay a utility bill, to keep in their house, there's no, I mean, people need resources. And I think that this has been one of the most impactful programs that we've ever done in the city. So I just want to commend you all, Ms. DeSazier, Angie, all the partners, council colleagues. I know it took us a little while to get this program pushed forward, but you know, it's incredible work. So I just want to say thank you. I'm always going to ask this question. It always goes back to budget. Where are we now with the Family Crisis Fund, and then what's being contemplated? Because I know we don't have anything budgeted for the next fiscal year. This might be a Ms. DeSazier question. Yet. I better have.
Right now, the remaining funds that we have through year end, I want to say is about 186,000, which should get us through the holiday. It tends to be a little bit slower. But and we average about 25,000 a week, so we should be able to make it with what we have now, the funds that are allocated. Then we have another tranche that will submit an invoice for another 362,000, and that should cover us through first quarter. So it's really the conversation about what this is going to look like in 2025.
Yep,
is that fair?
Yep, it is.
And so thank you so much for the question, Madam Chair, and then Angie, thank you for your response. And so we are tracking and having regular conversations with Angie so that we're on top of those numbers, because we don't want to end up in a situation where those funds are depleted. And I think that we have now started doing a far better job of that. And so as she shared, we're set for the holidays, right? I think we're in a very good position. And then as we look ahead to the next few months, we're also in a good position. But we are right now then looking ahead to what happens next and how do we make it through the remainder of this fiscal year, and then also planning for fiscal year 26 also. So all things that are top of mind, we're 100% on top of it right now. One of the things that we're also looking at is I'm constantly kind of balancing numbers and seeing if I can get an average of the number of people that we're supporting and how many dollars it's actually taking to do that, because I think that then helps us assess in the funds that are needed. But for now, I think we're in a good place, but obviously we're already planning for 2 to 3 months from now. What do we do then? So I anticipate us being back before you soon.
And then I also wanted to just ask a question as we look at the actual implementation of the program that we voted in on Tuesday, the GAP program, which would allocate up to $200 a month for 6 months for individuals who qualify, had income qualified through their income. DSS folks aren't left, but to defend themselves here. But I'd say, or speak for themselves, I would likely venture that they probably cannot nor should not take on the additional burden of administering that program. It seems like quite a bit of pieces to figure out. And so if there's an opportunity to look at either Humankind or another nonprofit, some other entity to get that out, because I mean, it seems like a very similar vein. It may make sense for us to outsource that. I was thinking about that as we were contemplating that program, just getting nervous about what that would look like in implementation. So
absolutely. So thank you, Madam Chair. I think we have been working closely with our Department of Finance actually on the development of that. And so we are relying heavily on some of their staff to really take on that initial onus. That final verification or approval process does lie actually within the director of the Department of Social Services. I think we are always open to any and all solutions. I think first we want to get it up and running. We will certainly see and reserve the right maybe to make some adjustments and share those adjustments if necessary with you all. But I do think that right now with our Department of Finance, they do have some capacity that they're lending us to actually review then applications as we move through that process, then with that final authorization or approval rather than coming through the director of the department. And so Director Giles, again, we've been working closely together on this with the finance and administration portfolio for several months now. So I think we're in a good place. But again, I really appreciate that support, and I can't say enough about our partnership with Humankind and the people that we are supporting. I know a lot of today's meeting has centered on our families, but this is one of the best ways that we are supporting them. And then later on in the meeting, I look forward to sharing an additional update on something else we're doing to support our families as well. Thank you.
I do have one quick question, Mr. Shazer. One quick question. So you all talked about the family crisis today, and then the success with the resource center. And I know we do a lot of that here in EHS. How do we get this information out to the larger, broader Richmond community? Because this is amazing, and I think we need to be talking about this more. And it kind of gets, everybody doesn't come to the EHS meeting. That's and right. I know specifically in my district, I'm dealing with a lot of this family crisis stuff. But how do we get this to the broader community so that folks not necessarily, they know what the resources are, but they also see that there's traction and things are moving?
I am so glad you asked that question. I think it has been one of the challenges that we're trying to overcome right now. I'm going to answer it in a very practical way and then come full circle back to the Family Crisis Fund and the mechanics of it, because I think it's important to understand those mechanics. But first, we are just trying to put together more resource guides to get out. I think I gave you a magnet a few days ago, right, that talks about our substance use resources that we have. We have now also created what we call door hangers that have all of our homeless services resources. But a lot of those materials simply did not exist. And so we're trying to drill down the information so it's more digestible for people. We are oftentimes throwing out email addresses and phone numbers and websites. And quite frankly, it's a difficult thing for residents to keep up with. So we're trying to find more innovative ways to actually share that information. One of the things that we're working on right now is more broadly just integration and interoperability across our portfolio. So when someone has an entry point, whether it's the Department of Social Services or whether it's our parks, right, whether it's a community center, how do we ensure that then they're connecting to all of our available services? Now, that is a longer term effort that we're working on, but in the meantime, we're trying to do our best with some additional assets like those door hangers, like the magnets and things like that. Specifically for the Family Crisis Fund, and the chair certainly knows as well, there are about a dozen partner organizations that actually make referrals. And so that's the way we facilitate it because we do not have unlimited resources, unfortunately. So we rely on those organizations, including our own Office of Community Wealth Building, to work with individuals in need to complete those applications and then ultimately get them over for review to humankind. And then those funds are ultimately released. So right now, it's about a dozen or so organizations. We would love in the future to be in a position to expand that to further get the word out. I will say that as the word has gotten further out, we have had to navigate some challenges with that. We have had individuals from other jurisdictions reach out from around other parts of the state and even outside of the state. That happened to us several months ago, and it was very challenging to actually get back to the Richmond residents that then needed assistance. And so right now it is working very well with those referrals, but as resources grow and expand, perhaps in the future, I think we can share it out a bit further.
And the reason why I was just asking also follow up, I'm sorry, is because I'm just thinking about for council is 9 of us. Most of us send out newsletters. We have huge, listservs. And so could it be similar to what you're saying, a resource, not necessarily document, but maybe some sort of information that we can share out? Because the more we share it out, the more the citizens share it out. And so I'm just thinking about how we can support it versus, you creating more work. How can we support it? I don't know. Maybe that's something we could talk offline, but I just envision sharing like this information with like through our newsletter, our monthly newsletters and at our meetings.
Absolutely. We will happily send you more emails. I send you a lot already, but I can send you a few more.
Mm-hmm. Yeah.
Thank you for that.
I know I would like to have that. So
thank
I don't want
you.
to speak for nobody else.